Epiglottitis. So in the pediatric questions related to a lot of these respiratory disorders, the most frequently tested ones are croup, bronchiolitis, epiglottitis, and pertussis. So now we're going to focus on epiglottitis. So one thing I usually look at in the question when I'm differentiating them is a vaccine record. Because vaccine record is incomplete for pertussis, but it's going to be normal for everything else. That's a big clue. So in epiglottitis, the big clue is going to be the airway obstruction, the signs of an impending airway obstruction. So all of the different, pretty much all the respiratory disorders, they can present with fever, cough, congestion, and things like that. But it's the airway obstructive signs that you need to recognize, like hoarseness of voice, stridor, dysphonia, the difficulty generating sounds, changes in your voice. I think I said hoarseness of voice, and on an X-ray tracheal deviation. When you look at them in the physical exam, they're going to be in their tripod position that's mentioned. So the main thing for all of this is, number one, you need to keep the patient calm in the management. That's where all the questions come from. And number two, you're going to intubate them. So, and this ends up being kind of the management, even if they give you a patient with an expanding neck hematoma. So if anything is happening in trauma and they tell you of an expanding neck hematoma, the management is kind of similar because you always want to protect the airway. So it's a similar management. Okay.